Dental problems are very common. One of the difficulties with dental problems is they usually don't hurt or give you any sign of being there until it's at a pretty late stage. It is not uncommon for people to come on in to see us on an emergency basis with problems that have been festering, with problems that have been brewing for quite some time, unbeknownst to them. The problem with dental problems, it is very difficult to determine when there's a dental problem in your own mouth. It's so common for people to say, well, it's not hurting me. And that's the real rub. When it comes to dental health, if you're using pain as a motivating factor, it's usually at quite a late stage for things to cause pain. Sometimes people will wait years, and then finally, when there's some discomfort or pain, that's when they'll come to find the dentist. And then it's often too late. Let me give you a common scenario. It's not uncommon at a regular checkup for us to find little problems, unbeknownst to you. Those little problems might be a little chip or a little crack or a small cavity forming or perhaps an area of bleeding gums. Those are the most common types of problems we see. But the problem is, they're not your problems because you're not aware of them. They're only your problems once you're aware of them. I think we all take pride in knowing our own bodies. We usually know when something is right and when something is not so right. For example, the other day, I was playing hockey. My ankle was hurting. I knew I had to do something about it. Dental problems are not quite as telltale. It's very common for people to not know they've got any dental problems. This is why the preventive dental checkup is such an important part of dentistry in this day and age. Little problems can be determined and a plan of action determined, if any, at a very early stage. One of the expressions that was taught to me about dentistry is, you can run, but you cannot hide. Little dental problems never go away on their own. They may not bother you, but slowly but surely over time, they will become bigger problems and bigger problems and bigger problems. My philosophy is to prevent the little problems from becoming bigger problems, or even from becoming catastrophic problems. Most people that have had a problem and choose to wait are not surprised that the problem has gotten worse. Most people that don't know that they've had a problem only find out they have a problem when it's at a very late stage, almost when it's too late. I would strongly recommend preventive dental checkups to determine if there's an issue or a problem at a very early stage, when it's easy to repair or very easy to treat. These dental problems do not get better on their own. In fact, they usually get worse. Not overnight, but they usually get worse over time. And they usually do not cause pain or give you any warning until it's way too late to do something about it. Or at the very least, it has become a very costly and tiresome project to get repaired. Wouldn't it be better to prevent a problem early on, when it's much easier to treat and repair, when it's way less costly to treat and repair, and when the remedy is one that will last for many, many years? I would urge you to develop a preventive approach, a proactive approach about your overall health, but especially about your dental health. The warning signs are usually not there until it's too late.